Hello, this is Shawn Hamilton. I am a registered nurse and clinical product manager here at Access. Today, I will instruct on the different attributes within our physical assessment sections of the Oasis and how to complete those sections appropriately. All the information for the comprehensive assessment, which is the head to toe portions, are marked in blue for easier identification and to speed up charting. Also, the special assessment sections, such as the Braden scale, are also represented by the same blue color. We have introduced a new concept of no problems identified within our assessment sections. What this does is it enables the clinician to perform problem-based and focused documentation. Once you assess the patient and identify what the problems are, we show you what I like to call the tip of the iceberg to not overwhelm you with tasks that are irrelevant to your current patient. However, when a problem is found, we have added robust documentation to immediately improve your clinical documentation. And I look forward to demonstrating that concept very shortly. For now, we will begin with the Patient History and Diagnosis tab. The Vital Signs section allows the ability to document temperature, respiration, pulse, and blood pressure. You're able to choose your route for temperature, the method for O2 sat, the position for heart rate measurement, with a new ability to expand this section in case you need to check positional pulse rates. For the blood pressure readings, you may select left or right and enter up to 3 readings, or you may expand the positions to 6 if they're needed. The temperature, respirations, pulse, and blood pressure readings are required for the note to pass validation, and if for some reason you are unable to record all 4 requirements, then you have the option to check the Unable to collect all vital signs checkbox, which is represented here, and then your assessment will validate. The BMI calculator is new. You will need to simply enter a height and weight, and we will perform the calculation for you. If your patient's BMI is good, we show a green check mark. If they are at risk, we show a red exclamation mark. Lastly, the Vital Signs section has been updated to allow the ability to document additional measurements. As you can see here, you also have the ability to add things such as the hemoglobin A1C and the patient's PT-INR readings. On the Risk Assessment tab are several areas for assessment. The first is the immunization log. We have not changed the functionality of the immunization log. You are still able to add pertinent information here, whether or not the patient actually had an immunization or if they declined or had contraindications to an immunization. Next is the shingles vaccine immunization. This is important for all patients, but especially if you are in a value-based purchasing state where the accuracy of this information is vital. If the patient has ever received a shingles shot, answer yes here and be sure to record it in the immunization log. If the answer is no, be sure to select a plan of care order to facilitate the administration of this vaccine. In the risk assessment section, there are 2 assessments here for your use, and the choice of which you use is totally up to the clinician or the agency's policy. The first assessment is a great tool and is used exclusively for patients coming directly out of the hospital. It is the 8 Ps from the SHM Project Boost. It identifies 8 key areas that are good indicators for readmission to the hospital. If the patient is identified as having a problem in any of these areas, an intervention is required to prevent readmission to the hospital. The second is the Acute Care Hospitalization Risk Assessment from HHQI. Many of you may already be familiar with this form because it's been around for a while. This tool may be used for patients without any hospitalizations, 30 days post-hospitalization, or a recent discharge from the hospital. And as you answer these questions on this particular tool, or rather as you choose responses that relate to the patient, you're able to see how the colors light. Once they get to 5 boxes checked, then generally they are considered to be at risk for hospitalization. The prognosis section features the Advanced Care Plan button. Obtaining information and ensuring every patient has advanced directives is a major initiative of Medicare. We have placed a link to the patient chart here to ensure the information is entered. If the patient is identified as a do not resuscitate, that information will flow to the clinical notes. So when you click Advanced Care Plan, you will come directly to the patient chart. If the patient on assessment does have an advanced care plan, you're able to click that information and to document all of the various advanced directives that relate to the patient and their care. Moving to Supportive Assistance tab. You must document the patient's cultural assessment, including their preferred language, and whether the patient requires an interpreter per the new conditions of participation. There is also a new psychosocial assessment. Medicare added this to the conditions of participation for the clinician to identify problems that may have a potential to negatively impact the patient's plan of care. In that case, CMS would expect the agency's social worker to work with the patient and/or their caregiver to mitigate the circumstances and to assist with removing any barriers that negatively impacts the patient's health status. Also, this is the first place we introduce you to the phrase, no problems identified. As stated before, no problems identified allows you to move quickly through the assessment documentation without having to read so much information per body system, thereby decreasing cognitive overload. This is problem-focused charting. If a problem is identified, there is robust charting options present to assist you with clinical documentation improvement. For example, if there aren't any problems, you would just simply choose no problems identified, and the sections will collapse. However, if there are problems identified, when you choose that answer, it will reveal robust information for you to document what you are assessing. Here we have home environment altered. If the patient have any of these attributes, you will simply check them and they will flow to the plan of care. If there are any barriers to health, likewise, you're going to check any of these answers, and you can check as many as you need, and they will all flow to the plan of care. In the sensory status, you can add information for the following. Again, here, there's a lot of information that appears whenever you need it. If you don't need it, then you just simply would choose no problems identified. In the pain section, you will first answer a question which will guide your documentation. It is important to note that the question is not asking if the patient is in pain. Instead, you want to know if the patient is having any pain that interferes with their ability to move. If the patient is asked, "Do you have pain?" and they have been sitting comfortably in their chair, they may say no. But if they are asked to think about if they have pain when they get up to walk, as an example, you may get a truer response to this question. So if no is the answer, then no further information is needed. However, if they select yes, then the clinician is presented with more robust information to fully document the patient's pain status, including the primary site, their current pain intensity, the attributes of the pain over the past week, the description, nonverbal cues, pain measure relief, the current pain management effectiveness, and the potential or aberrant behavior noted. Current pain management is looking at mood, sleep, pain. Well, let me show that to you. So when you choose this is important for building your medical necessity and why the patient is requiring help. And what you'll see here with current pain management, you're looking at the mood, the sleep pattern, the physical function, and the psychosocial function. It is important to note the impact the pain is having on these areas and charting the progression of the pain status from visit notes all the way to an improved status in the discharge oasis. Aberrant behavior is very important to document as it will reveal those activities that are a potential detriment to your patient's plan of care. Now, when we go back to the top, if the clinician chooses that the patient is unable to communicate, then you will receive choices for a nonverbal pain assessment, either the Wong-Baker assessment or the pain AD, which is for patients with dementia. So if you choose the Wong-Baker assessment, then you will get nonverbal symptoms to include here. If instead you choose the pain AD assessment, this assessment is a validated tool, and it takes a look at the patient's breathing, their negative vocalization, their facial expressions, their body language, and their consolability. And then it will generate a pain score for you based upon the attributes that are chosen here. The integumentary assessment includes common problems associated with alterations in skin status, including wounds. So when we get to the wounds section, the descriptions for wounds are standardized and follow the same descriptions that will appear in the plan of care and the wound documentation. The Braden scale serves as a pressure ulcer assessment per the Oasis guidelines and helps to determine if the patient is at risk for skin breakdown. We have not changed the functionality on this scale either. The respiratory assessment includes common signs and symptoms associated with alterations in respiratory status. If there are no problems, again, you're going to simply choose that response and move on to answering the 2 Oasis questions that are presented. If problems are discussed, document those problems, which will reveal more clinical documentation improvement responses. It's important to note here that if the patient is on oxygen, then an O2 risk assessment is required to ensure patient safety. Whether the patient is on intermittent or continuous oxygen, the assessment is the same. If no risk is noted, then you will simply mark no safety risk noted. However, if there are risks noted, then you will check those responses and promptly notify the physician and the clinical manager responsible for the patient. Move into Cardiac Status tab. If there are no problems identified in the cardiac assessment, you can move on from that tab very quickly. So we click No Problems Identified and you're done. However, if there are abnormalities identified, you're going to select the response and document fully. If you have a patient with edema, for example, we do have some new functionality here. We give you the ability to choose the grade, but also the objective data to choose from, so there is less discrepancy from clinician to clinician based upon the edema grade alone. So you're able to add the edema grade as well as the location. And if you need more locations, you are able to hit this plus sign. And if you want to get rid of the location, you can click this minus sign. The Elimination Status tab references the genitourinary and the gastrointestinal assessments. This tab is a little longer because they both are here. You always have to input the last bowel movement, but if your patient doesn't have any GI or GU problems, you can mark no problems identified. Of course, if they do have problems or things that require more care, you are definitely able to mark those items, such as what we have here. In the neuro assessment, we must always document the patient's orientation status. If there are no abnormalities, then we will simply mark no problems identified. If there are neuro or behavioral abnormalities, please choose from the drop-down list of responses. And again, when there is a problem, we give you robust information where it is needed to explain exactly what is going on with the patient. If your patient is being admitted for a total hip or knee replacement and does not have any other comorbidities, this assessment will be easier, with the ability to document no problems identified and to focus on problem-oriented documentation. You can document any musculoskeletal abnormality. As it relates to the fall risk assessment tool, the Missouri Alliance of Home Care, or MAC-10, is a validated fall risk assessment tool. Nurses will fulfill the requirements of completing a fall assessment with the use of this tool. The TUG assessment is not required, but it is available for your use. So if you want to use the TUG assessment, you can click and answer the questions there. But if you complete the MAC-10, it does satisfy the requirement. The endocrine tab is a combination of the endocrine and hematological status. You're able to document information for anemia and cancer. And then there's expanded documentation also for the diabetes section. So you're able to really document a skill need for this section. You're also able to document abnormalities regarding nutrition status. We have included here augmented documentation for tube feedings. The next section is also the nutritional health section. And in this section, you're able to document a patient's risk for nutritional problems. If the patient's nutrition is good, we highlight that in green. If it's moderate, it will turn to yellow. And if they have too many risks, then what will happen is it will turn to red. On the medications tab, we kept the same functionality to enter the medication profile to add medications to the plan of care. And if you need to document medication administration, you're able to do that here as well. But there's also a new section, and it is the medication status section. And in this section, you can document fully on various items, such as whether or not the medications were reconciled, medication issues that have been identified, whether or not your patient is using an anticoagulant, pill box pre-filled, insulin syringes pre-filled, and intravenous or infusion therapy. Medication reconciliation is a requirement of Medicare and the Nurse Practice Act, so you want to be sure to be able to document that function. Lastly, the supplies are entered via the supply worksheet and will flow to the plan of care. Please enter all of your supplies to be used for the patient. Enter the DME items as well. It's important for this information to be documented. It's also important to include contact information for the DME company. So this concludes this session on the OASIS assessment. We will review the plan of care orders or the interventions, the OASIS questions, the therapy eval, and a summary of care coming training videos. Again, thanks for your time.